I want to dedicate this speech to my dad, who was diagnosed with type 2 diabetes several years ago. And so this motion does really speak to me, because for decades the national rate of diabetes has increased to levels that are putting a strain on the national health system. Not only do those suffering from diabetes have reduced standard of living, but can also drastically affect the lives of those around them. In Australia, there are 1.3 million Australians registered on the National Diabetes Service Scheme. That is more than 1 in every 25 people. Every day, over 280 people are diagnosed in Australia with diabetes, with nearly 500,000 Australians suffering from type 2 diabetes who have not been diagnosed. This is a growing crisis that needs to be addressed urgently. Within the next 5 years, it is estimated that a possible 2 million Australians with pre-diabetes may develop type 2 diabetes. Australia is known around the world for its high standards of living and active lifestyle. But with such high numbers of people in this country suffering, that this is hardly not the case for so many other Australians. It is not a political issue but a pragmatic one that demands a long-term solution. Diabetes is not a simple illness and is frequently the cause of many other health complications. It makes sufferers of diabetes vulnerable, less productive, and more reliant on the public health system and those around them. Australia is a caring country, a compassionate nation, which is why we can do better when it comes to assisting those with this illness. We cannot afford for entire generations to fall ill at a time when the technology and expertise exists to prevent many from developing this sickness, and support those with diabetes to live a healthy and productive life. This government has always had vulnerable Australians at the forefront of reforms to ensure that they are given the help they need. That is why we are delivering on our long-term commitment to assist Australians suffering from diabetes with the Australian National Diabetes Strategy. This is a far-reaching program that engages children and young adults, as well as health card holders and pregnant women, with access to affordable help. This program is being launched in conjunction with a number of complementary initiatives, including the Diabetes in Schools program. The KEEP site program, as well as a number of prevent diabetes-related amputations. This is the holistic approach we are taking to combat one of the most significant and long-term health issues that this country has faced over the past decade. Rising public awareness on this issue remains critical to encourage healthy habits and lifestyles to give Australians the tools to take control of their own health. Empowering individuals has always been the policy of this government, because there is no substitute for the power of the individual. Rather than blanket policies which replace individual choice with the Canberra bureaucrat, we are building a nation that empowers Australians to help themselves. Nowhere is that more crucial than in regard to a person's health, because no two people are alike. The 2020 Australian of the Year, Dr James Muack AM, has been critical in his work as an ophthalmologist, pioneering preventative type 2 diabetes in many poor and developing nations. James has been instrumental by encouraging healthier lifestyles and healthier environments. His work continues to affect the lives of many, and his message is relevant all over this country. Recognition of his work is rightly deserved. We have a long way to go, but it is because of the work of our health workers throughout the country that we are making a difference. There are many in my electorate who rely on the selfless acts of kindness that those in our healthcare sector display day after day. It is frequently a thankless task, but one that could not be more important, and we thank them.